This is the latest edition of Front Up, and I'm Whitey Willauer, and I've got a great guest today here, Tim Cummings. Tim, tell me a little bit about yourself and what you do here on the island.
Well, I'm currently working with a grant. It originates with the White House Office of National Drug Control Policy. Comes down through the SAMHSA, the Substance Abuse and Mental Health Services Administration. And it's delivered to an organization here on Nantucket in the community called the Alliance for Substance Abuse Prevention, otherwise known as ASAP. That's the idea, is they're trying to reduce alcohol and drug use, especially among youth, because a lot of the research tells us, which is no surprise to anybody, that the younger someone is when they start using drugs or alcohol, the more likely they are to have problems with it. Mm-hmm. So a lot of the programs that are supported by the Drug-Free Communities grants are environmental strategies, and they're also evidence-based practices. By that I mean that they are strategies that have been used in other communities successfully. So we have the opportunity.
That's evidence-based? Yeah.
Correct.
Okay.
Yeah,
so
they have evidence that they work.
Well, what kind of things are we trying to do here?
Well, in terms of environmental strategies,
sure.
We're doing some things around trying to change attitudes, perceptions, misconceptions, maybe some myths, and influence people's behavior in that way.
How do you find out the kids' attitudes and myths and things like that? What process do you go through?
Well, the main tool that we use for that, we do some focus groups and things like that, but the main tool we use to get some objective information is something called the Youth Risk Behavior Survey. That's a survey that was developed by the Centers for Disease Control. And nice thing about it is it gives us some comparative data. We can compare ourselves versus the rest of the United States or that sort of
Massachusetts and things like that.
And
how well do we compare with these other places?
With regard to, well, we were just talking about this the other day because we had a drug take-back event, which
we're
is
going to have to find out what you mean by that, but
sure.
Yeah.
But for example, in the area of prescription drug abuse, we came out about even with the rest of the country on that. Mm-hmm. In 2007, nationally, about 20% of the kids that responded to that survey said that they had abused prescription drugs in the past 30 mm-hmm. days. When that same survey was given to our school kids here, 18% of them gave the same response. So it's
what kind of drugs are they playing around with?
Well, the big thing now is within the realm of prescription drugs, and it's specifically the opiates, the narcotic drugs, things like Vicodin, Percocet, and OxyContin, mm-hmm. Things that contain oxycodone, which is an opiate narcotic drug for pain relief.
Where are these drugs coming from? Are they getting them from the drugstores, or where are they getting them from?
The majority of abused prescription drugs, according to a national survey, National Household Drug Survey, are supplied by friends or family for free. I think 60-something%. So about 2/3 of the people reported that they got these drugs for free from a friend or family member. And that might be by someone giving them to them, someone just leaving them in the medicine cabinet, that type of thing. And we've seen an uptake in that activity nationally. For example, I was just reading something that someone sent me from the Los Angeles Times this morning. An article that said that the Centers for Disease Control has now identified prescription drug overdoses are now killing more people in the United States than car accidents are.
Yeah, that was, yeah. Now, is there is there trading going on? In other words, are they bringing these prescription drugs to the island? Is there a trafficking going on?
Well, according to the consulting that I've been doing with different members of the community here, and we do have a committee, if you will, coalition getting together around this issue. It involves medical professionals, law enforcement officials, educators, other concerned community members. According to the information I'm getting is that it's both. There are some people bringing drugs on island illegally. There are also a lot of drugs in people's medicine cabinets at home legitimately, who got legitimate prescriptions for them that are just way too accessible, especially to young people. There's also a problem of people, for example, a person who may have a history of alcohol or drug dependence, who may be in recovery, getting an injury of some kind and then being prescribed an opiate pain medication, and then finding themselves becoming hooked on that medication, becoming dependent upon it.
Yeah.
It's really important for people to talk to their physician about those issues. It's also important for people to clean out their medicine cabinets from time to time.
So what are we doing about cleaning out medicine cabinets?
We had a drug take-back event, as I mentioned earlier. We sponsor these periodically. We have...
when was that?
January 10th. It was on Wednesday.
Okay.
Yesterday. And we took in... I think what the police officer attending said that we took in more narcotics than we've ever taken in on one of those events before.
I have some drugs in my medicine cabinet, and I'm no longer using them, regardless of what I use them for. You know, I should bring them down to one of these take-backs and bring
absolutely,
them down. Yeah,
absolutely.
Yeah, why not just put it down the toilet?
Well, as a matter of fact, there's a couple of websites. We went on the DEA website, as a matter of fact, and that's one of the things the DEA still has on their website.
Now, I gather you're doing some other things besides the drug take-back.
Sure. One of the things we're talking about in terms of environmental strategies is working on people's attitudes and beliefs and perceptions. And one of the misperceptions that a lot of young people have when they're offered, let's say, alcohol or marijuana or one of the other drugs that typically are the drugs that kids are initiated into, is that, you know, there's a large amount of people doing this all the time, that everybody's doing it. That's where we come in with things like social norming campaigns. I'll explain a little bit what that is. We take a idea like that, and then we gather some data on what's really happening, such as the Youth Risk Behavior Survey, and then we publicize that data to show, for example, here's a piece of information we got, and the manner in which we started publicizing it.
Now, what does this tell me?
This is it says here, fact, 88% of 7th and 8th grade students at Cyrus Pierce Middle School did not drink alcohol in a typical month. According to the Youth Risk Behavior Survey that we did last year, 88% of those students reported that they hadn't used alcohol in the past month. Now, that's a far cry from everybody doing it. So if you're a 7th or 8th grader and you want to follow the crowd, let's say, well, that's where the crowd is going. We worked with some of the kids to come up with some of the other activities they like to do.
Tell me, 88%, that's the actual. What do the other kids think is happening?
Well, I think that there's a perception that a lot more kids are doing it. I don't have the actual figures here for you right now.
It's greater. In other words, the kids
absolutely
think that more is happening than is actually happening.
Yeah.
Yeah, so you have to turn that around.
Yep. And then they identified several different kinds of things that they like to do, such as riding bikes. And then they had.
Now, who made these?
I worked with a guy by the name of Brendan Lawler,
Here,
who worked at the Boys and Girls Club. He's a very talented graphic artist. And the actual ideas and images come from the
this? Now, I've got to put
students
this down
themselves.
a little bit.
Sure. This says the same thing, but it's just about dancing. That one's about bike riding. And this latest one that's out now is about swimming. So these were the favorite photographs of the students that were in these focus groups. They liked these the best, so that's the ones we used.
Good.
So the statistics come from the kids and the
Perceptions.
the photographs, the whole thing.
So you do that. Now, what's your approach after that? You show them that it's different. What they perceive is different from what is the actuals. What then happens?
Yeah. Well, as a matter of fact, I'm going into the health class in 7th and 8th grade tomorrow.
Now, what other objectives do you have besides this?
Well, our main objectives are to create coalitions here in the community. That's something that's been proven to work, to reduce drug and alcohol misuse. We've got a lot of strategies going. We've got a training program coming up next week that I'm doing with facilitators for parents, based on a model that started up in Maine called Table Talks, and then that migrated down into Massachusetts, and we got some folks. One of my colleagues from Middleborough is coming down to help us out with that, to train some parent volunteers who are going to carry this program further. But it's about educating parents on strategies to prevent underage drinking, strategies
So
they can use in their own families, their
enlisting
neighborhoods.
parents to participate in the tabletop exercise.
Actually, here in Massachusetts, it's been called Surviving the Teen Years. That's the name of it. So we have a small cadre of parents who are going to get together next week and work on that. We have some students and staff and parents at the high school who are going to work on an after prom party.
After prom, you're going to have a big party after the prom?
Absolutely. Keep them up all night. Have a lot of fun. I've seen these things in action before, and as a matter of fact, I was talking with somebody at the Friends of Nantucket Public Schools, Jennifer Frazee, who is originally from the northern New Hampshire area, and she recalls similar kinds of events we had up there. She happened to go to the same school and work with it there. That's our hope.
And you're going to put them, where are they going to stay overnight?
We're going to have the opportunity to use all the facilities of Nantucket High School with permission of John Bucky and Mike Kozort.
And how do you keep them in one place?
Well, we're not going to keep them in one place. We're going to open up certain facilities to certain activities, such as the gymnasium will have
it's in
basketball.
One facility.
They'll all be in the high school facility, but there'll be, for example, there'll be music and dancing and food in the cafeteria. There'll be basketball, badminton, all kinds of other activities, indoor soccer going on in the gymnasium. There'd be perhaps movies going on in the auditorium. I don't want to say too much about what's going to be happening, because part of that is created by the students themselves. We did a bunch of questionnaires with the students to find out what kind of activities would they want to do, what kind of entertainment would they want to have, what kind of refreshments would they like to have at an event like that. So we're going to meet and go over all the results of that and take it from there. I have the junior class officers working with me on that. They're very excited about the whole thing.
That sounds like a wonderful way to end up our scholastic career. Yeah, that's great. Well, thank you, Tim, and it's been a pleasure.
Thanks, buddy.
And I'm glad you're doing this drug-free communities, and best of luck.
Thanks very much.
Thank you.